Blue Sky Plan includes a tremendous amount of free automated functionality built directly into the software. As you could see on screen now, we have automatically segmented from the CT scan the jaws, the teeth. We have identified and marked the nerves. We have designed and automatically placed the tooth, and we have placed the implant. One of the most important and integral automated functionality in the software is the alignment of the optical scan to the CT scan. While the CT scan is integral and important for accurate implant placement and treatment planning, the optical scan is just as integral and important for the proper design and fabrication of the surgical guide. If these two surfaces are not aligned perfectly, there could be deviations in the surgical guide at the time of surgery. Now, for those of you that have been involved in surgical guides for several years, you can remember how tedious and painstaking the process used to be of aligning the model to the CT scan. Today, the functionality is automated, but it is important that the user confirms and reviews proper alignment of the optical scan to the CT scan. And in this tutorial video, I will demonstrate how to do that effectively. In order to confirm proper alignment, you can hide all other surfaces and just leave on the screen the CT scan, make sure it's confirmed and marked as visible, and the imported optical scan, make sure it's marked as visible, and make sure the hint column is activated as well. What the hint column does is it turns on an outline surrounding the particular surface. So in our situation, we could see the blue optical scan on screen, and in addition, we can see an outline of the scan as well. Now, as we go through the slices, especially in our horizontal axial view and in our vertical cross-section view, we want to confirm that the blue model is wrapped tightly around the CT scan, especially in the area of the teeth. In the area of the teeth, we expect there to be no deviation in the size and the shape of the teeth in the optical versus the CT scan. And as we move through our slices, using the slider to the right of the view or scrolling through the wheel of our mouse, we could see in our situation, as it should be, the outline of the optical scan is tightly wrapped around the teeth. In addition, as we go through the vertical cross-section slices in the same way, either using the slider or by using the wheel of our mouse, we can once again see that the optical scan is wrapped tightly around the teeth. We could use the top button to the right of the view to maximize the view, and we could hold down the right mouse button to zoom in and zoom out. I have manually distorted the model positioning now in order to demonstrate what an inaccurate alignment might look like. First of all, we could see that there's a space between the outline of the model and the CT scan. As we go around the arch, here we could see as well that the outline of the model is impinging onto the CT scan. As we move closer to the occlusion, we could see that the optical scan is now showing the outline of the cusps, while the CT scan is still showing the entire tooth. Step number 1 is to rerun the automatic model alignment. Simply click the automatic button in the model manipulation panel. In some situations, especially when the optical scan is scanned completely in opposite positioning relevant to the CT scan, it is a good idea to click Manual and use the widget on screen to rotate the model to be generally aligned in the same direction as the CT scan, and only then click Automatic to rerun the automatic model alignment. If this still has not resolved the issue, click on the Points button to be able to mark particular points in both scans. If this did not resolve the issue, click the Two Teeth button to indicate to the software which teeth should be used for alignment. Hold down the Shift key and left click on particular teeth. Disperse the dot markings throughout the teeth on the model, marking at least 5 different points. Now it is important to mark the same teeth in the CT scan. The order of the points being placed does not matter, and it does not matter if you mark the CT or the optical scan first. Once you have placed points on teeth in both scans, go ahead and click on OK. If this still does not resolve the issue, click on the Points button. Now we are going to indicate particular points on particular teeth that the software should use for the alignment process. So once again, hold down the Shift key and left click to mark points. But in this situation, make sure to mark particular identifiable points that are identical on both scans. Disperse the points around the arch, marking at least 5 points as you go. Once again, the order of the points between the two different scans is not important. Once you have done that, click the OK button. The alignment will be improved accordingly. And finally, if needed, activate manual alignment by clicking the manual button. You can now use the widget to modify and improve the alignment as necessary, to rotate or move the model. If you would like to move the positioning of the widget itself, simply use the smaller arrow keys to realign the widget positioning and thereby modifying the axis of rotation for the model. In addition, when the manual alignment functionality is activated, you can also use the keys on your keyboard to move and nudge the optical scan accordingly.